problem. We are overwhelmed with diabetes. At present, 12% of the adult population above the age of 20 is diabetic. Continue like this, then by 2050, 1 in 3 of us will be diabetic. Now, the diabetes itself is diagnosed when the fasting blood sugar is greater than 126 fasting. However, before this is a very crucial stage which is often missed. That is pre-diabetes or metabolic syndrome. And we know that this stage can be reversed, can be prevented. And why does it occur? It occurs because sugar is ubiquitous. We unknowingly consume far too much more than the pancreas was designed to control. We have a finite number of insulin molecules in the pancreas. However, thanks to the environment changes, high fructose amine corn syrup, artificial sweeteners, genetically modified foods, we consume far too much sugar. So now what happens is there's an imbalance of insulin and of sugar. And what is diabetes? Diabetes is nothing but fatigue of the pancreas, imbalance. So when we are diagnosed with type 2 diabetes mellitus, 50% of the insulin production is gone. So now we have to deal with 50% of the remaining insulin for the rest of our lives. So we have to obviously catch the stage before this happens. And this we do, which I've been doing in my practice for the last 10 to 15 years, is checking the insulin level, the C-peptide level, and the hemoglobin A1C when the patients first come in and tell them that they have pre-diabetes or metabolic syndrome. At this stage, we train our patients to be very careful about the foods we eat and of course combine it with exercise, which is very, very important as it increases the insulin sensitivity. We also treat our patients with both pharmacological drugs such as metformin in pre-diabetes. This is not being utilized as much it should be. I've had so many patients for the last 10 to 15 years who've been on metformin, whose hemoglobin A1C is still maintained at 5.5. They don't have diabetes. And the reason I started metformin was because the insulin resistance was high initially and their C-peptide levels were high. So, diabetes mellitus can be reversed, pre-diabetes can be stopped right where it is, and all this can be made by lifestyle changes, use of some supplements such as berberine, metformin, alpha lipoic acid, changing our diet, and a lot of exercise.